Hi, my name is Christopher, and we are MINDWELL. Today, we will discuss with you managing individuals' needs for development and wellness in the workplace through effective leadership and learning. I will begin with a summary and brief history of mental health in the workplace. Mental health and well-being in the workplace impact both the organization and the worker, and understanding this relationship is vital. There are key steps that can be taken to help mitigate some of these impacts. Communicate frequently with employees about mental health. Implement innovative and impactful rewards programs, and institute coaching and development programs that empower employees. As far back as the 1700s, there has been an understanding of the impact of the workplace on the health of the employee. While the Industrial Revolution changed the way the world worked, those impacts persisted. In 2017, a study out of the United Kingdom found that there were substantial tax revenue losses in the tens of billions of pounds and drops in productivity by the same measure due to the impacts of poor mental health well-being of employees. There is a documented correlation between increased mental health distress in the workplace and increased chances of cardiovascular disease. Stroke risk, coronary heart disease, and cardiovascular disease mortality all increase when long hours, overtime, or job instability and job insecurity rise as well. We can clearly see the negative impacts of poor mental health well-being spilling from work into personal life. When examining nurses throughout the world, we can point to clear connections between work stress and poor mental and physical health that are indeed global. Nurses in Indonesia report increased dizziness and the inability to sleep. Nurses in the United Kingdom were 43% more likely to report stress due to work, and nurses in the United States ranked above other health professionals when documenting stress. Workers, like nurses, must possess high psychological capital to handle these stressors. High psychological capital is tied to higher levels of optimism, hope, self-efficacy, and resilience. Lower levels of these factors lead to increased chances of negative impacts from work-related stressors. Next, we will hear from Sophie on the causes of these work-related stressors.
According to a 2018 study in the International Journal of Hospitality Management, more than half of all employees undergo intense stress, and 2/3 encounter difficulty focusing on their jobs due to stress. Research shows work stress can lead to depression, fatigue, obesity, hypertension, diabetes, and sleep or eating disorders, and result in reduced job satisfaction, increased turnover in tension, and lower overall performance. In this section, we will discuss 4 causes of work stress for management to consider. According to Swyerts and Ezedine of the George Washington University, modern work has become knowledge-based, fluid, and intellectual. Overworked people think about work all of the time, and for many people, work has become cognitively intrusive. If your employees are ruminating about work issues on their off time, this can lead to lower job satisfaction, burnout, and increased work-life conflict. According to Sullivan and Blundell in their paper Help, Lonely at Work, Managerial Interventions to Combat Employee Loneliness, 62% of employed adults and 79% of Gen Z individuals report that they are lonely. However, loneliness does not end with our personal lives. Workplace loneliness is a disconnect between employees' desired and realized social interactions at work. This disconnect reflects a shared responsibility for relationship building among employees, their managers, and the organization. Subtle discrimination is defined as acts of incivility and rudeness directed consistently to stigmatized groups. For example, asking women to perform menial tasks, or a manager who rarely praises the performance of minority team members. Cognitive resource depletion is a temporary reduction in ability or willingness to engage in activities after an act of violation. A 2021 study of undergraduates determined that subtle discrimination can lead to cognitive resource depletion, more so even than overt discrimination. This can lead to decreased performance, productivity, and creativity in the workplace. We have all heard of the antidote to work-life conflict, work-life balance. Research shows organizations can help their employees find balance through greater autonomy, flexibility in job roles, supporting non-work priorities, and work-life initiatives and policies. As said by Dr. McEwen, blaring car alarms, controlling bosses, 2-career marriages, 6-mile traffic jams, and rude sales clerks were simply not part of the plan. Managers cannot solve all of these problems for their workers. However, organizations are responsible for factoring work stress into their decisions around policies, initiatives, and benefits. But to what extent does this benefit the organization? Next, John Guthrie will discuss the benefits and costs of mental health initiatives in the workplace.
Thank you, Sophie. What do Google, Apple, and Salesforce all have in common? One thing is that they are all known for investing in the mental health of their employees. Another is that they've all run cost benefit analysis and came to the same conclusion that mental health benefits outweigh the costs. These companies offer employee benefits like the ones listed on the slide because they understand how mental health affects their workforce, sales, and revenue. The benefits listed on this slide are some of the perks that organizations can expect after investing in their employees' mental health. One of the benefits that can create cascading effects is increasing their public image, which leads to hiring advantages. Attracting larger candidate pools allows organizations to vet and hire quality employees, employees who will reflect company values and fit within its culture. Increasing employees' organizational citizenship behavior through mental health leads to higher customer satisfaction and lower costs. This commitment increases the perceived organizational support, which has been associated with lower turnover and higher job satisfaction. BetterUp, a company that provides virtual coaching to organizations, conducted a study about how detrimental lost productivity can be. The authors of the study say that in the workplace, poor mental health and its clinical counterpart, mental illness, can present significant challenges to individual, team, and organizational functioning, with approximately 19% of working adults in developed countries suffering from a behavioral health disorder and almost $1 trillion in lost productivity to the global economy as a result of depression and anxiety alone. They also state that happier employees display more citizenship behavior in the workplace, are better performers, and earn higher salaries, demonstrating tangible benefits for themselves, their colleagues, and their employers. To avoid diminishing returns, you just have to believe. Keep benefits basic, evaluate and adjust, understand it's a long-term commitment, have individual flexibility, engage and listen to feedback, set verifiable goals, and increase education and training. Let me hand this over to Mikey to discuss employee empowerment.
Feedback is a way of evaluating employees' performance, assessing their professional lives and goals, and providing suggestions to improve. How and what type of feedback is delivered to employees affects their future engagement and motivation, and determines whether employees feel heard, valued, and appreciated. There should be a balance between positive and negative feedback, so managers should focus on strengths, but also acknowledge that there are areas of improvement. There are several feedback methods, but these are the most common ones. Informal, anytime you spontaneously comment on something. Formal, it is planned and scheduled time to talk about performance. Constructive, it is observation-based. Analytical, it is results-oriented. Positive feed-forward, planning and setting future expectations. Negative feed-forward, corrective approach for the future. Self-evaluation feedback and motivational feedback helps inspired employees and is unique to each of them. During the pandemic, completing performance evaluations was difficult because work responsibilities were constantly changing and not all employees were working. During and after the pandemic, a method called Performance Promoter Score was implemented to measure employee performance at all levels without the technical details specific to one job. It covers the likelihood of recommending working with employees or teams, why, and what would take to increase that score. These are some tips for effective feedback. Feedback should be delivered with respect and care for employees to accept and implement the suggestions. Include positive feedback to motivate employees and encourage learning and professional growth. Along with feedback, provide guidance and resources to improve employee performance. When providing negative feedback, note the time and place the situation occurred, describe the behavior, what was said and done, and describe the impact the behavior had on feelings, thoughts, or actions. Next, we will cover employee empowerment.
This section focuses on equipping employees with tools to enhance their own well-being, offering management strategies for driving self-empowered employees, and examining the role of self-evaluation within the feedback process. Employees have several tools at their disposal to enhance well-being, including mindfulness meditation for improved self-awareness and emotional regulation, mindfulness-based stress reduction programs to manage stress, open monitoring techniques for a broader awareness without fixation, mindfulness-based cognitive therapy for preventing recurrent depression, and the monitoring of well-being outcomes through self-assessment. These practices These practices empower employees to proactively manage their mental health and understand the impact of mindfulness of their overall well-being, fostering a more resilient and balanced work life. Management can drive self-empowered employees by offering training and development opportunities to enhance competence and confidence, reducing anxiety and promoting overall mental well-being. Delegating decision-making authorities reduces feelings of helplessness and boosts employees' sense of control, crucial for mental health. Autonomy fosters ownership and responsibility, elevating stress associated with micromanagement. Recognition and rewards for contribution enhance self-esteem and mental well-being. Creating a supportive work environment encourages collaboration, providing a safety net for employees facing mental health challenges. Overall, these strategies contribute to a positive and less stressful work environment. Self-evaluation plays a crucial role in promoting mental health and empowerment in the workplace. By encouraging employees to reflect on their well-being, these assessments lead to increased self-awareness, aiding in the early detection of mental health issues like anxiety or burnout. They enable the development of personalized coping strategies and self-care routines, fostering a proactive approach to mental well-being. Self-evaluation prompts employees to prioritize self-care activities, enhance communication about mental health, and identify workplace stressors, allowing employers to implement changes that reduce these stressors. This proactive approach supports the development of resilience, contributes to a supportive work environment, and overall leads to an increased job satisfaction, productivity, and retention. Let me now pass it on to Abigail Morales to discuss feedback methods and their impact on well-being.
Now that we've talked about some feedback in the workplace, let's talk about some studied recommendations for improved mental health in the workplace. According to the Chi-Square analysis, it was revealed that roughly 55% of employees who had previously experienced depression or anxiety episodes stated they would like more conversations in the workplace regarding mental health. The Chi-Square analysis also revealed that roughly 35% of employees who had experienced previous anxiety or depression episodes stated they would like their organization to make more time to discuss concerns or issues. And previous research found that training managers in workplace mental health improves their knowledge and attitude to address any mental health concerns and self-reported behavior in supporting their employees who experience mental health problems. This slide provides the data analysis of increased needs and wants for more focus on mental health in the workplace. It states that 77% of people agree that workplaces should take active steps to help their employees with their mental health. I have two tables. Table 9.1 discusses what helps in managing mental health and employment, how responding to mental health problems at work with support and encouragement from colleagues, and tolerance and sensitivity at times of lower productivity versus meeting them with annoyance, aggression, or resentment, how managing absence and returning to work with negotiation of suitable work arrangements, which may mean a new role or new work setting, and having understanding by all parties that recovery is a gradual process, maintaining positive mental health with openness about mental health in the workplace and making work itself suitable and enjoyable. In table 9.2, we have the positive potential circle of openness and support for employees, where employees talk about mental health problems they experience. The employer then gains more awareness and understanding. And then employers are more confident in engaging with the employees about mutual health problems, which creates more effective support. And then it goes back into employees are able to talk about their mental health problems they experience at work.
Investing in mental health initiatives, benefits, and training isn't just good for your employees. It makes good business sense too. The overall cost of high turnover rates, low job satisfaction, lost productivity, burnout, absenteeism, and presenteeism can be significantly reduced by cultivating a company culture that values work-life balance and empowerment, prioritizing training on how to provide feedback, and utilizing self-evaluation tools to check in with your staff on the individual level. To conclude our presentation, we will leave you with these words from Canadian Prime Minister Trudeau. We all have a responsibility to raise our awareness about mental health. We must actively encourage honest and open conversations in our homes, our workplaces, and our communities, about what mental health is and what we can do to increase our collective well-being. We must listen to our loved ones, our colleagues, our friends, look out for signs, and offer them support and advice in times of need. It can be challenging for all of us to cope with the fast pace of life, daily stresses, and obligations. We all need to stand